Good afternoon, everyone. The title of my paper is Occupational Exposure and Incidence of Sharp Injuries Among Healthcare Workers in Ophthalmology. Needle stick and sharp injuries are major occupational hazard among healthcare workers. The increase of risk of spread of highly contagious blood-borne pathogens causing lifelong illnesses like HIV, HCV, and HPV. On an average, about 1 in 3 healthcare workers globally is at risk of needle stick and sharp injuries. Ophthalmology has advanced as a fast-growing microsurgical branch which involves use of various types of blades, sutures, and needles under the microscope. This requires development of great hand-eye.
Now only, doesn't matter. Just started on.
This requires development of great hand-eye coordination and stereopsis by years of practice and experience. The risk of injuries while operating and passing instruments is relatively high in residents as well as the assisting personnels. The dim light in the ophthalmology OT also makes visualization difficult, especially during transfer of instruments. Improperly disposed needles and blades pose a risk to housekeeping staff while handling the biomedical waste. An online cross-sectional survey was done and it was spread in all medical colleges and teaching hospitals across the country in the Department of Ophthalmology specifically by using snowball sampling method. A questionnaire was prepared with consultants and residents of various medical colleges. The residents were encouraged to share questionnaire with nursing and housekeeping staffs in their respective vernacular language. And all the healthcare workers other than ophthalmology were excluded from the study. This study was under the, with ethical clearance, institutional ethical clearance. The results was a total of 512 responses were recorded, out of which 312 residents, 86 nurses, 69 sanitation workers, and 45 consultants answered the questionnaire, and 108 healthcare workers suffered needle stick injury. Out of which, most of the rates were found by passing of instruments in the nurses and by disposing the biomedical waste by the housekeeping staff. Among the results, the type of sharp object causing injury was solid needle, then by sharp blades, and then by hollow bore needles. And out of all those people who participated, 73% only reported to hospital infectious care unit. And only 14% received post-exposure prophylaxis, and 86% did not receive PPP. Our study showed comparison with the Sharp et al., which said 76.7% prevalence, and Talwar et al., which showed 55.46% prevalence in healthcare workers. Rishi et al. Reported 140 needle stick injuries over 5 years, and highest in the fellows and nurses. Trotman et al., according a study which was done in Switzerland, said 42.7% of ophthalmic surgeons experienced needle stick injuries. In our study, it showed prevalence of 21%, nurses at higher risk, followed by housekeeping staff, and the main was by instrument transfer and waste disposal. Hollow bore needles pose a higher risk due to blood retention. Deep percutaneous injuries increase hepatitis B infection and HIV transmission risk up to 16 times. And 72% of the injured healthcare workers wore gloves, and 28% did not. Double gloves and face shields, eye protection reduces exposure. Regular training is essential for PPE adherence. 93% underwent testing, and 7% did not. PPP was received only by 14%, and most deemed injury low risk. And PEP most effective within 2 hours and continued for 28 days. Knowledge, training, and reporting issues, only 17.3% of housekeeping staff knew the post-exposure protocols. Gap in training and stigma led to underreporting. Some healthcare workers sought external testing for confidentiality. So the strategies for prevention to reduce incidence of needle stick injuries, we promote adopting neutral zone transfer techniques instead of hand-to-hand instrument transfer, strengthening biomedical disposal protocols to minimize risk of housekeeping staff, and mandatory and repeated training sessions for all healthcare workers, particularly sanitation workers, to enhance knowledge of post-exposure management. We conclude that in ophthalmology department, sharp injuries happen frequently to surgeons as well as team, including nurses and housekeeping staff. Needle stick injuries remain a major occupational hazard. Training and policy enforcement are essential. Hospitals should strengthen reporting systems and post-exposure protocols to minimize risks.